DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Hi there and welcome to DocTalk. We're sure glad you joined us today. We're going to have a great show. We're going to talk about pinkeye and cattle. My guest today is Dr. Matt Meisner, and he's an associate clinical professor here at the Veterinary Health Center at Kansas State University's College of Veterinary Medicine. It's bound to be a great show. Stay tuned.
We do use Multimin in our cow herd, and we're finding that there is a benefit. It seems like those cows breed back better. And we also found that by giving our bulls a shot of Multimin just before we turn them out, we really get a kick out of that. I've definitely recommended Multimin to several people, and it's a good product.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Matt, welcome to the show.
Glad to be here again.
Well, it's always a pleasure to have you here. And folks, Dr. Matt Meisner is a associate clinical professor here at the Veterinary Health Center, and he is boarded in large animal internal medicine. And Matt, we're going to talk about something that's very common in cattle. It's something we see every summer, pinkeye.
Right.
And let's start out discussing, what are some of the things that causes pinkeye?
Sure, that's kind of, as we discussed before, it's kind of becoming a hot topic about this time of year is pink eyes and problems with cattle in their eye. And pink eye is probably one of the more common ones that we see, and it's an infectious problem of the eye. And actually, there are some specific bacteria that we talk about that cause the infection. But what we find is that we have a lot of other players in the environment that come in to aid them bugs. And this time of year, those things are coming about: sunshine and dust and things like that.
It's kind of like when we talk to students, tell them there's two reasons animals get sick: either an overwhelming dose of a pathogen or a suppressed immune system. And this is really one of those that is an example of that.
Exactly. Yeah. I mean, in the specific bugs that we talk about causing it, one being the Moraxella bovis, and you'll see that in a lot of vaccines and whatnot. We'll see that bug. And it can cause problems, but it usually needs something to help it get a toehold. And something disrupts the eye, or their immune system's poor, and then all of a sudden we start to see this type of infection show up, and it can be pretty devastating and just run wild through a herd.
So when we start to talk about some of the different things that, we talk about Moraxella bovis and some of the infectious agents, what are some of the non-infectious agents that can help set up pink eye or cause something like pink eye?
Irritants. So an irritant such as dust, grass-awns, sometimes composted bedding, sunlight, anything to irritate the surface of the eye or that cornea allows that bacteria that sometimes can be on the eye normally just grab a toehold and then cause this horrendous infection.
What about flies?
Flies. Yeah, flies are irritating. Not only do they disrupt the eye and scratch it up, but then they'll grab it and go right straight to the next one, so they can carry the...
They can carry. Yeah. And we see that with foodborne pathogens like E. coli with flies transmission, and so...
Right.
So they could actually carry the bacteria from one animal to the other.
Yeah, that's right. Some of the way we get these massive spreads through a herd when we have an outbreak is flies and fly control. And they're irritating, and they're just nasty little bugs.
Yeah. Well, I think it's important to understand the bugs. I think it's important to understand the irritants. When we come back from the break, let's jump in and start talking about how we diagnose some of these problems and move forward with pink eye.
Great.
You're watching DocTalk. We're glad you joined us. We'll be back in a moment.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information.
Dr. Dan here. Whether I'm driving up and down the roads covering the state of Kansas, or I'm getting between Riley and Manhattan for my job, I'm driving a Ford truck. I'd like you to come out and visit my friends here at Dick Edwards Ford. They have a truck that'll suit your needs, whether you're looking for power with a Power Stroke diesel, or if you're looking for fuel efficiency with the new EcoBoost engine, they got a truck that's just right for you. They're located 2 miles east of the Town Center Mall in Manhattan, Kansas, and they'll bend over backwards to help you. And I'll see you down the road.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook. Specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle, Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Hi there, I'm Dr. Dan Thompson from DocTalk, and I'm excited to team up with Vance Publishing to honor some of the youngest and brightest professionals in agriculture today. And you can help us by nominating someone you may know. If you know somebody under the age of 40 that excels in animal production or food animal agriculture, food safety, transportation, or others, you can go to DocTalkTV.com and nominate someone for this award. Help us honor those who help us feed the world for generations to come, and I'll see you down the road.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Noromycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd.
Welcome back to Doc Talk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Matt Meisner, who is an associate clinical professor here at the Veterinary Health Center, and he's also a boarded large animal internal medicine specialist. And Matt, we're talking about what causes pink eye. Now let's get back to, and a lot of people can diagnose or have seen pink eye cases, but let's go through what you see as kind of the clinical signs first of pink eye and different levels of severity.
Well, and we certainly see a lot of cattle sent in with a white eye that may or may not turn out to be pink eye. But the biggest thing about pink eyes, we'll see these kind of very nice centered looking like scars right in the middle of the eye, and they really rapidly spread. The big thing about pink eyes is very painful, so they're tearing a lot, and there's a lot of watering eyes and squinting and trying to stay out of the sun. And then it'll get to where it almost looks kind of abscessed or infected, where you have this kind of white area that kind of spreads across the eye. The surrounding portion of that eye just gets really irritated and angry, and it's very painful. And so at that point, did we get a sticker in it? And there's still a sticker in it.
Right.
Or are we dealing with a pink eye problem that could be an outbreak or kind of some situation that we could do?
You see how these cases can manifest, and some of them get a little bitty scar, and some of them get that pop eye, and is there anything to the severity? Is it more of a calf by calf situation, or?
I think you get back to where we talked about before. We get overwhelming dose and individual immune system, and so a lot of their immunity to fight this thing off is in their tears, and some have a more specific immunity to that bug, and these bugs can change rapidly even within an outbreak, to where that immunity that's on that individual calf may not be totally effective, and so we'll see some of them that just have massive infections, and others seem to be status quo for a little bit longer, but. Yeah, there's quite a bit of individual variation.
And we always recommend people work with their local practitioner. What are some of the things practitioners might do to get a better diagnosis of what's going on? Maybe of course we do the clinical exam and the physical exam, but what are some things diagnostically that we might do?
Well, if we're looking for a specific bug, they can culture it. We can take swabs, we can send them to the diagnostic lab, and they can tell us what what bacteria, what bug is there, and is it one of these that are pink eye bugs. But I always tell people too to really, every single one that we swab, take your finger and sweep it through the back of the eye and look for grass-ons.
Yeah.
You know, so that's part of the diagnosis is, yeah, we're going to find a bug, but we're also going to try to make some other management tools to prevent the risk factors. And
You
so,
bet.
hey, we got a bunch of grass-ons. We better get these things out, and then we'll figure out what bug we got. So, yeah, a bunch of different ways to do that.
So it can be, what are some of the other differentials that might be on your list?
Oh, we've seen viral things like IBRs and BVDs and, you know, just overall traumas. And in older cattle, we might see some that think they're cancer eyes or different situations, some odd situations. And I've seen white eyes where they were just bacterial infections in the eye. They weren't an eye infection. So there's several different things it could be, but it's pretty
clear.
Yeah, it's pretty clear for the most part.
When we come back from the break, we're going to talk with Dr. Meisner more, and we're going to talk about how to treat those pink eye cases. You're watching Doc Talk. We're glad you joined us, and we'll see you in a minute.
In the springtime, cattlemen need to be thinking of preventing important diseases like pink eye. Pink eye prevention includes management factors like good fly control, pasture management, along with a good vaccination program. Eyesight from AgriLabs has broad efficacy coverage as its origin from 8 different field isolates of Moraxella bovis. It is safe, smooth, highly syringeable, safe with young calves and pregnant cows, and provides superior protection against pink eye.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
I'm Dennis Tebow. My wife and I, Kathy, are the owners of Wolf Creek Cattle Company. We have grown to approximately 70 bulls.
I'm Reese Arnold. I'm the livestock manager at Wolf Creek Cattle Company. You know, these are not just like normal cattle. These cattle, they're hauled anywhere from, 8 to 10 hours a day across the United States and asked to perform. The Multi-Man 90 keeps them kind of level. It maintains and balances their system. The stress level's less when, when everything's right and working right, then they're working right.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
Hi there, and welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Matt Meisner. And Dr. Meisner is a boarded large animal internal medicine specialist here at the Veterinary Health Center. He's also an associate clinical professor at Kansas State University. We've been talking about pink eye, and we're going to talk about treatment. And before we jump into it, the one thing we always recommend on Doc Talk is that they have a valid veterinary client-patient relationship and that they work with their veterinarian to get a proper diagnosis and plan of attack on treatments. Because as we discussed during the break, there's more than one way to skin a cat on pink eye treatment.
Absolutely, yeah. And I don't really think there's a wrong way to treat them. I think that you're going to find several different methods, and what works for your veterinarian works for your veterinarian because it's worked for your veterinarian. So
Right.
If that's where we want to go, we can stay up with current thoughts and current trends on bugs and antibiotic sensitivities. And whenever they get that chance to culture and do a sensitivity, they might pick a specific antibiotic this time, whereas they might pick another one the next time. Just depends what they're going to do. It's nice to have that. But so an antibiotic is one of those things that we like to have direction on, but we don't always. So we may just kind of randomly pick one initially and see if it's going to work. Next thing, I've seen procedures where the biggest thing is getting them out of the sun, protecting that eye. It hurts as long as that sun's beating on them, so we may glue a patch on.
Get the irritants, the sun, the flies, the dust,
Yeah.
get it off of there.
Protect them. So I've seen patch glued on. I mean, there was a time when I was cutting out old Levi's to make patches that we could glue on the eye. And also prevents flies from getting on that and going to the next one. I've seen other situations where we're injecting penicillin near around the eye and then covering it with a suture.
Yeah.
So that's another method that you might have seen, or any of the people out there might have seen their veterinarians do. Depends on facilities, what you have to work with, where you're at, and how you're going to treat those. But it's nice to get on it and have a direction and stick with it, and make some scientific choices through the course.
Any preference for you, systemic versus the localized injection of antibiotics?
Well, everything that I've read has shown that either a systemic antibiotic, there's a couple mentioned, or the locals, the duration of the disease is about the same. You know, and most of the big studies looking at overall cure rates and time, they're all about the same. You know, one thing I do advocate is an anti-inflammatory, though, because those eyes hurt. You know,
what would be some examples of anti-inflammatories that you?
Flunixin, Banamine, and I've even seen dexamethasone or steroids used, depending on how bad they are.
Just to help with the pain of the eye and
Sure.
reduce the inflammation around that cornea.
Right, and some of them get bad enough that they get beyond treatment, and then at that point it's probably a good idea to take the eye out. So we've had to go that far too.
So antibiotic, systemic or local, get an anti-inflammatory, and if it gets bad enough, we may have to remove the eye.
Right. Yep.
Great. We're going to take a break. When we come back from the break, we're going to talk about ways to prevent pink eye from occurring in your herd. Dr. Matt Meisner has joined me today. You're watching DocTalk. We're sure glad you joined us. We'll be back in a minute.
This segment is brought to you by Purple Wave Auction, the easiest, most straightforward way to sell used equipment. Purple Wave, straight, simple, sold.
This is Agriculture Today from Kansas State University. The pork industry is on full alert now for a new and serious herd disease called porcine epidemic diarrhea virus, or PEDV. Swine health experts like K-State's Steve Dreetz are advising producers to watch closely for signs of this costly disease, especially in nursery pigs.
When this virus is introduced into the herd, it's very devastating to the young nursing baby pigs. They're the most susceptible. It basically destroys the whole intestine of the young baby pig, and they're unable to take in any nutrients and causes diarrhea. Older pigs will exhibit signs of diarrhea, but usually recover.
This is K-State Research and Extension.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there, folks. Welcome back to DocTalk. Dr. Dan Thompson here with Dr. Matt Meisner from the Veterinary Health Center. He's a boarded large animal internal medicine specialist, and he is an associate clinical professor. And we have been talking about pink eye, and it's something that happens in all the cow herds, and we've gone through the causes, the bugs, the ways to diagnose it, treatments, and now we're going to talk about prevention. And I told Matt during the break, I said, we better start out with vaccine because that's the one everybody's going to want to know about right off the bat. And what are some of the general thoughts or opinions on vaccinations?
I think that the general thoughts is, they wouldn't be there if they didn't have some benefit, and I believe they do. And then there's also the vaccines that we have that we can culture that bug. You can send it into a lab and have that bug made into a vaccine, meaning an autogenous vaccine. And I've heard all of those used. And then on my side, I kind of look at the evidence and try to figure out, is it a cure-all? No, it's one of these bugs that can change so readily within an outbreak from year to year, from herd to herd. There's a couple of different bugs that they're actually questioning now. So it's pretty wide. It can help. I think what we've pretty much consensus is if you use your vaccine and it's not really cutting the mustard, you might spend more of that money on some other preventive measures, which we get into secondly. But the vaccines, they're there. They're a good tool. Use them if they're not working. We need to kind of focus on the other 5 or 6 different problems
things that might make a little bigger difference.
Because treatment is a nightmare. It's one of those, when you get into a big mess, it is a lot of labor and a lot of work and a lot of frustration. So prevention is the big key here.
What are some of the other, we talked about the irritants. What are some of the other things that we might do to kind of prevent?
Sure. So, the irritants being grass-awns and dust. So we can limit dust if we have the ability to keep moisture on the ground in pens. We can mow the seed heads off the pastures to limit all the grass-awns that could get in there and irritate the eye. We can have shades just to keep that under control. UV light, fly tags, different things, fly preventions. Those are huge. And if we can get all those added up in an efficient way, I think we can limit it a lot. I have clients that will start mowing pastures here to limit their exposure and kind of irritants for pinkeye. They've had it in the past, and that's one thing that works to limit it. And so,
well, I've even seen some deals on fly control that'll be coming out that fly control delivered in a paintball gun.
Oh,
yeah, yeah. So it could be kind of fun a way to get rid of flies in here.
And then lastly, I think good nutrition. Good strong nutrition, keep them healthy, keep their immune system going. Trace minerals and overall energy. I think we'll keep them healthy.
Well, appreciate you being here today.
Sure.
Appreciate you joining us too. If you want to know more about what Dr. Meisner and I do here at the College of Veterinary Medicine at Kansas State University, you can find us on the web at www.vet.ksu.edu. And remember, we always recommend that you work with your local practitioner. You've been watching DocTalk today. We've been talking about pinkeye. We're really glad you joined us. I'm Dr. Dan Thompson, here from the College of Veterinary Medicine at Kansas State University. I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
DocTalk, produced in cooperation with Drovers Cattle Network and Bovine Veterinarian. For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
There are 2 problems with trace mineral intake in beef cattle. One is simply that intake of trace minerals can be slightly unpredictable. The second thing is that other minerals that are present in the diet in high proportions can actually interfere with trace mineral absorption. Sulfur is a classic example of this problem. Many of the feedstocks we use, like distiller's grain and corn gluten feed, are high in sulfur. In some cases, groundwater and surface water in Kansas can be high in sulfur. When dietary intake of sulfur is high, that means that copper in particular and also possibly zinc can be absorbed from the gut in less than ideal proportions. When injecting a trace mineral product, you bypass that source of trace mineral antagonism in the gut, because the injected product is taken directly into the circulatory system for processing in the liver and deposition in the various storage sites within the body. A breeding female's body reserves for trace minerals are a little bit like a bank account. When there are periods of demand in that breeding female's life, her bank account of trace minerals is rapidly consumed. I mean, two examples of critical physiological periods of need would include parturition, lactation, and then breeding that immediately follows the initiation of lactation. During these periods of time, the breeding female's body reserves of critical trace minerals are being constantly drawn down. In my opinion, the use of Multimin 90 allows a producer the option of assisting a beef female to perform at her genetic optimum through an optimized trace mineral nutrition program. It's possible to incorporate Multimin 90 treatment in conjunction with other health protocols such as vaccination for respiratory disease and clostridial diseases.